BFR Tuesday. My name is Ed Cara. I'm the Director of Education for Smart Tools and Smart Cuffs. And I do this every Tuesday to have an opportunity for people to ask questions regarding blood flow restriction training. So if you have any questions, reach down towards the chat section. Like I'm going to type in hello from Dallas. And you'll see in that chat section, you can just put a question. I usually give everybody a minute or two to jump on. And then if anybody has any burning questions that they have for me, they can ask. And then if not, I'll go into what I plan on discussing today. All right, doesn't look like we have any questions. So I got a present today in the mail, super stoked. My Gen 3 smart cuffs. So finally able to get them in. So that's what I was going to talk about today is our Gen 3 basically. It's about a year, 2 years in the making, delays because of COVID and programming and all the other stuff, but finally got it. So I got to give a lot of credit to HQ up in Cleveland, Dr. Closey and his family to get this thing out because it's been a serious ordeal, lots of moving parts, and so amazing that we're getting it. So I want to kind of introduce it to you. As many of you know, not everybody knows, but originally we had 5 different sizes of cuffs. And so this is the older version. This was Gen 2. And you can kind of see the width on these things. We always want to maintain at least a 5 centimeter width minimum. Anything less than 5 centimeters is considered narrow, which requires more pressure. So, and more pressure on the limb is more uncomfortable and also can be a little bit more, I don't want to say dangerous. Dangerous isn't the word. Can be a little bit more stress on the underlying tissue. So we want them as wide as possible, yet functional. And it's a balance between width, comfort, safety, all those things. That's what we're always playing with. So you'll notice this is the older, this is my size 3 cuff, Gen 2. And so you're looking at this width and the leg, the standard leg, not too much different. This is pretty close to what, if not exactly the same width. But if we look at the one for the upper extremity, you'll see that it is quite a bit more narrow. So here's the Gen 2. You can always tell because of the valve. So the valve on this is white and the valve on the new ones is covered with a mold. So this is my upper extremity cuff that I use personally. And you'll notice here the width difference. So it's not a small difference. It's if I measure this width, oh, I'm all over the place today. If I measure this width, we're about 7 centimeters on the new version, this one here, and on the older version, we're closer to probably about 12 13 maybe. I don't have my tape measure right in front of me, but quite a bit of difference. And the reason is what we were running into is when the cuff was on, a lot of people's biceps were kind of running underneath that cuff. So we decided to make them a little bit more narrow, yet still stay within the evidence-based guidelines of 5 centimeters or wider. It's nice only having 3 cuffs versus 5. What we were finding was that very rarely did we need a size 5 cuff for folks. Some of my bodybuilders, big linemen. You know, we were just able to take 5 cuffs and bring it down to 3. I think a little bit easier for storage. So that's cool. So let's talk about the pump. I think the biggest upgrade is the pump. So, you know, what we want is something that automatically measures limb occlusion pressure, so we no longer have to do that. And the ability for the pump to measure limb occlusion pressure and then inflate directly is a game changer. It's going to save a lot of time and effort. It'll save a lot of training. And essentially, I need to plug these in still. And they'll charge about once a week with my usage here. So you'll get, you know, numerous days in a normal clinic charging of the actual unit. So what'll happen is on the interface, this is touch screen, or you can use the controls. You put the cuff on and it will inflate, find your limb occlusion pressure. And then depending on if you have the Pro model or if you have the general model, there's different programs that you can utilize. With the Pro model, you can go to 100% limb occlusion pressure. We decided with people that are purchasing the consumer model to not allow that. So if you do use 100% limb occlusion pressure, which we really only use for ischemic preconditioning, non-exercise based BFR, then you can have that programming built in with the Pro version. So you see kind of, we put these extra long tubes on there to make it easier for connection. So lots of cool upgrades. We've learned a lot in the last 5 years doing this. And I think we really knocked it out of the park with this one. So I'll plug this in and get it going, hopefully start to utilize that later with patients. Let me answer a couple questions here. Chuck is asking, for those of us that did the early pre-orders, when can we expect delivery? Yeah, we're expecting, I think we wanted to do about a 1-week trial. We're pretty sure everything is all set, but they should be shipping no later than the end of next week. Might be earlier. Some of them, these were kind of like the first few to get out and make sure that we've got it dialed in, but they should be getting out, I would say, no later than next week. Don't quote me on that. That's not my decision. They come from Cleveland, where headquarters is. I'm in charge of more of the education, and so I control that, but they will get these out ASAP, but no later than the end of this month. I mean, it'll be within this week or max 2 weeks. So thanks, Chuck. Any other questions regarding our Gen 3 cuffs? I do want to say, you know, thanks so much for being patient. Everything that we do seems to take twice as long and twice as expensive as we originally intended. So I think you'll be happy with the upgrades and the usability and the ease without having to find somebody's limb occlusion pressure, yet still following evidence-based guidelines. Any other questions for me today? I kind of want to get this thing plugged in and get started ASAP. So I'm going to keep this short. Just wanted to show you that they have been released. Give some peace of mind to those that did pre-order that, yes, we are just about to get these things shipped. And I'm going to play around with it this week. And then I'll probably do a little bit more in-depth next week. But I thought people would be excited to know that we are getting those released. We ordered a week ago, Pro Unit. We're giving Gen 3 other info. Which will we get? Oh yeah, hey Rob, we only sell Gen 3 now. Gen 2 has been retired. We ran out. It's been a month or two ago. So everything you're gonna get. And the reason that we did that is the Gen 2 cuffs, the actual cuffs themselves, will fit with the new pump. So even if you bought cuffs 2 or 3 years ago, they're still gonna work with the new upgraded pump and with the built-in Doppler. But anything that's been ordered within the last couple months is all Gen 3. So we wanted to make sure that was very clear. And that's why we stopped selling Gen 2 so early. You know, a lot of people are saying, you know, why can't we get these? And what we didn't want was, you know, October 31st or September 31st, you buy a set of cuffs and it was Gen 2. And then the next week, all of a sudden Gen 3 comes out and you're like, hey, I just spent all this money. We didn't think that was fair. So I think we've been very candid with, hey, this is about when the release is going to come. We're anticipating this change this year. Know that, so that way you're not getting hit with, oh my God, a surprise. Yes, there's been some delays, manufacturing delays, but I think everybody will be pretty happy with what it comes out. The pump does not, Chuck, the pump does not stay on through a session. You inflate it, it finds your limb occlusion pressure, then it lets all the air out, then it reinflates depending on what intensity you set. And you can set your intensity manually. So if you know what your 50% limb occlusion pressure is in the upper extremity, you can set it. You can hit same as last time, meaning use the same pressure. So if you're using it between, let's say you're doing upper body exercises, and I do bicep curl, I get done with my bicep curls, I deflate, and then I want to go to tricep extension, all I do is reattach and hit same as last time. It'll automatically inflate. What else? And we wanted the pump to not stay attached the whole time, because otherwise this hose is always getting in the way. And then you've got to attach this to you somewhere. You detach, you inflate the other one, you detach, you exercise, and then you deflate, wait a minute, go to the next exercise. The consumer version is really friendly too. It has, it basically just says, do you want low intensity, medium intensity, or high intensity? And so we're gonna recommend, from an education and programming standpoint, your first couple of sessions start with low intensity, meaning, and that's all meaning of pressure. It's never gonna exceed 50% limb occlusion pressure in the upper extremity. It's never going to exceed 80% limb occlusion pressure in the lower extremity, except for in the pro version, if you specifically state you want to do ischemic preconditioning. If you don't know what that means, don't worry about it. That's a setting that we use in the clinic. But it's very easy. Choose upper extremity, choose lower extremity, low, medium, or high intensity. Inflate it. Do you want to find your limb occlusion pressure? Do you want to use last time or your pre-destined? And what's cool too about these is that they can be updated on the fly. So even if we make little small changes over the course of the next few months, which I'm sure we are. I mean, look at your iPhone, you know, how many times do we get updates on this thing? We get them all the time. And so when we get updates, we'll be able to do that over the cloud. So no need to have to send them in, no need to upgrade. You're just gonna do an update to the software version, which is very, very cool. So hopefully that answers everybody's questions today regarding Gen 3 cuffs. Big day for smart tools and smart cuffs. You know, with the affordability factor of these, now you're getting automatic pressure, automatic limb occlusion pressure, and taking another step away from the clinician or the individual of having to find limb occlusion pressure and the variabilities with limb occlusion pressure. And the cost is, you know, a fraction of what other cuffs on the market that do the same thing are. So any other questions for me today? So if you have pre-ordered these, look for them in the next week or so, but definitely not after October 31st. It's gonna be before then, unless some major glitch comes in. But they've already been vetting these for a few weeks now, making sure that there are no problems. And so I don't expect any major hitches, probably some software things that we need to update over the next few months. But yeah, super excited, and I can't wait to get my hands on these and start utilizing them with patients, and I'll report back next week. Thanks so much for joining. If you ever have any questions you want to ask me specifically, I am Ed at edlecara.com. I'm also going to be doing a webinar in a couple of weeks. I've been asked to do something around marketing for not only for BFR, but whatever modality you have. So I don't have it in my background, but a lot of times I have my shockwave. And so before I go and I purchase blood flow restriction training, I purchase a shockwave unit, I purchase red light therapy or infrared sauna or sleep pods or whatever I do in the clinic, I do a return on investment analysis. I do other things from a business standpoint to see when my return on investment is going to occur. And I'm going to be talking about the way that I market my individual services to my people that refer to me, but also where I can go out and drum up new business. So if you're interested in that, look for an email from me in the next week or so. It'll probably be late after clinic hours, and I'll give you some ideas on ways to reach out to people maybe you don't have exposure to, and so then that way you can drive new cash paying clients to your clinic, because we're all cash here at Body Lounge Park Cities, and so we want to be able to maximize new equipment as we get it. But I want to know before I even purchase this stuff, is it going to be profitable? Because I have to basically take money out of my pocket and put it in to purchase this stuff, just like most people that are on this call. So, all right, thanks so much. I look forward to seeing you guys next week, and I appreciate your support. Thanks.